passion for their cements.
Maternal health in Nigeria is a critical issue with high mortality rates and significant challenges in access to quality care. Nigeria contributes a large percentage to global maternal deaths, and a woman's lifetime risk of dying from pregnancy-related causes is significantly higher compared to developed nations. So in 2025, we're still hearing this news of a woman dying during childbirth. On this edition of Health Watch, that is our focus. We're talking about maternal health, and our guest in the house is Dr. Ademola Yusuf Harun, popularly known as Dr. Love. He'll be telling us the challenges facing maternal health in Nigeria and what can be done at this time, all right? Plus, we have a report on CPR, cardiopulmonary resuscitation. This is a basic life skill that everyone should have regardless of your occupation. We're going to do a recap on that report. I know I've done that report before, but we're bringing it back to you so at least you get to understand what to do if someone faints around you, if someone slumps around you. You have this life skill. If you have this life skill, you can do something at least before you get to the hospital. All of these on this week's edition of Health Watch. My name is Nkem Okibe. We'll go on a short break now. When we return, you'll meet my guest. Dr. Love is in the house. Welcome back. If you're just joining us, the program is Health Watch, and today we're talking about maternal health. Our guest today is Dr. Love, Dr. Ademola Yusuf Harun. You're welcome to Health Watch.
Thank you very much, Nkem. It's always a pleasure.
You're welcome. So I know that the topic for today is something that you love to talk about. It's an area that you love to talk about. However, one of the things we need to understand first, when we say maternal health, what areas are we looking at?
Maternal health is a field that captivates my interest most. When we talk of maternal health, we are not looking at only one person, because for you to be a mother, then that means there must be a child. And also there must be a man that will have made you a mother. So maternal health is a holistic health care system that determines the state of health of the mother, of the child, and even of the father, because the sperm or the chromosomes from the man that would fertilize the egg must also be healthy to have a healthy baby. So we are looking at it in a holistic way, not only in a narrow or myopic perspective. So when we look at maternal health, the deviation from health is sickness or death. So we want to avoid maternal mortality or maternal illnesses. That is why we are focusing on maternal health, the state of well-being of the mother during pregnancy, even before conception and after delivery. So these are the things we are looking at. What are the risk factors to maternal diseases or maternal disorders or maternal mortality? In Africa, especially West Africa and Nigeria being the most populous country in Africa and the most populous country, the most populous black nation in the world, we have a big challenge of maternal mortality, maternal health, or maternal diseases. One of the common factors we have or problems we have is ignorance. Many women in our society, they are more comfortable to go to a TBA, traditional birth attendant, to have their children. And these factors are due to the complexities which the hospitals or health centers have put forward in delivery. For example, in 2025, some hospitals are still asking for the husband's blood donation before they can admit the wife for antenatal care.
Why is that so? What are they actually doing with them?
This is highly discouraging. We know that some women, for one reason or the other, may not even be able to produce their husband or the father of the baby. There are many circumstances for a woman getting pregnant. So, based on ethics, we are not to probe too much into a woman's personal life or reason for conception. She might just get pregnant and wants to give birth without even a man's interference. We don't know if she even did an IVF. We don't know if, in quote, she was even raped. So when you force her into bringing a man again, you don't know if her husband even passed away shortly after getting her pregnant. Or we don't know if they divorced or if there is no man actually. So asking for a man in all antenatal cares or admitting the woman for maternal care is not something that is going to be encouraged by all women. And that is why some of them might go to TBAs or traditional birth attendants where they don't do such. Another problem or setbacks in some hospitals is that they ask even the man to donate blood. And jokingly, when we were in hospital, when we were in medical school, we'll be asking, are these blood banks, are they vampires? Are they drinking the blood of all these people? What are you doing with all the bloods? We know that a large number of women give birth without blood transfusion. Many of them don't even require cesarean section. Significant of the ones that even require cesarean section don't even take blood transfusion. So why do you make it mandatory that they must always donate blood? I know it is for other things, but it is a complex system which has to be simplified to enhance health care and promote health delivery to these women and their children.
So the first question here is, what are common health risks faced by mothers during pregnancy and childbirth?
So the health we are going to look at, we are going to look it into preconception, during conception, which is the antenatal period, and postnatal or post-conception. So in the pre-conception, part of the health challenges they may have are underlying health conditions that the woman had even before getting pregnant. For example, if she is hypertensive even before getting pregnant, if she is diabetic, then her maternal conditions or her conceiving might worsen these cases. What if she has an underlying disease like HIV, human immunodeficiency virus, or hepatitis? These are conditions which you have to look at. And that is why when a woman gets pregnant or conceives, her antenatal screening is that she has to do a blood test to check for HIV, hepatitis. Also, part of the challenges women may have may be a blood group or genotype. Is she a sickle cell patient? Is she SS? Even if she's AS, we have to know. Is she AA? Her blood group also, is she rhesus positive or rhesus negative? If she is O negative and the husband is O positive, there is a chance of rhesus incompatibility in the baby. And we have erythroblastosis fetalis, rhesus incompatibility. So we have to know all these factors which could lead into birth complications. We also have to know the family history of the woman and the man. Is she a woman that our elder ones or younger ones or our mother had birth complications? We have to also know, then now coming to antenatal period, we have to check the woman regularly. Some women don't even have any problem before conception, but when they get pregnant, wow, the whole problems come. She may start developing diabetes in pregnancy, hypertension in pregnancy. Even she might even become very obese. She can even have what we call preeclampsia, developing swollen feet, proteinuria, and even hypertension. And many other, due to the pregnancy, she might even become very obese, swollen, massively edemic, swollen. Someone who was very slim, as they call leper, and again, she just swole up like a balloon. These are some of the conditions in pregnancy. Then we have the postnatal condition. After delivery, some women get depressed. You gave birth to a child, but you are sad. Some of them start having postpartum depression or postpartum effects. So we have to look at maternal health in a holistic perspective.
So what do you think are the issues actually? Is it the brain drain affecting the health sector? Is it the fact that a lot of people are still living in ignorance? I know of someone who is very exposed, very educated, and she says, I'm going to give birth at the traditional birth attendance home. I was surprised, you know, but I don't know if you're also looking at the fact that there can be like a collaboration with the government. I don't know, but I need you to pinpoint what are the challenges? Why are we still going through all of this at this point?
Now, this is a very important question. I spoke with a woman last week who just gave birth, and she told me that she gave birth in a TBA, traditional birth attendant. Why did you go there? Cost. So one of the factors why many of them are using TBAs and not going to government hospitals is because of the cost. Government hospitals should be one of the cheapest, and in some countries it's even free. Even if it's not free, like Canada, like Saudi Arabia, is even free. Then America is subsidized, or you have Medicare or Medicaid. But Nigeria is very expensive for some people to afford. Imagine someone having to pay ₦500,000 or even ₦1,000,000 for cesarean section. Normal delivery is hundreds of thousands of naira. These people can't even afford 3 square meals. How would they afford that money to pay for delivery? It's very, very concerning. So in TBAs, they don't pay up to that. It's very cheap. So there should be a good collaboration between the government and TBAs. I advise that TBAs should be trained to understand the medical procedure and medical ethics, and they should also be certified as certified birth attendants, not just TBAs. They should become CBAs.
So what role do you think healthcare providers should play in ensuring quality maternal health? And I use the word quality because when we're talking about maternal health, the people at the grassroots are the worst hit. All right? So what role do you think they should be expected from them?
There is something called the QA, or quality analysis. There's also something which we call ISO, International Standard Organization. There should be a standard, as you have said now, which looks at the quality of healthcare. One of the example is that if there's going to be delivery of any child, there should be standard, there should be proper aseptic procedure, because it is something that has to be clean. Also, there should be a criteria in which the child who is going to be delivered will have gone through at least, even if they are going to see a TBA, they should see at least a consultant or a certified medical doctor at least once in their birth history to make sure that they don't have conditions like placenta previa. A TBA may not know what is placenta previa, and I'll just say it in a layman. There are sometimes the placenta is in the lower part. So when you want to give birth, the woman is first notice the bleeding, and in symptoms of it is that the woman is bleeding even in pregnancy. So TBAs may not know what that is. They might just feel it is something and they make some concussions. So I implore that there should be a well-documented process in which all people follow, both TBAs and even matrons, nurses that are taking delivery, so that everybody is on the same page, and the Lagos State or Nigeria in general has a standard healthcare delivery. I will emphasize again that the TBAs should be incorporated into it, not sent away. No, teach them the basic delivery and the standard so that everybody is carried along on the same page.
Okay.
And there should be screening also. Well, I'm happy that TBAs are also doing screening now. Because when you go to a TBA, they know all those blood routine tests they take, because they themselves don't want to get infected. So the woman I spoke with who said she gave birth in a TBA because of the cost, she couldn't afford government fee. Imagine when you can't afford a government fee, then imagine what you can afford. So she said that in that TBA, she was sent to do HIV tests, blood group, hepatitis, genotype. Those are basically, and they are even sent to do scan now. So the TBAs also now know when the position of the head is up, is down. They know if it's placenta is down, placenta previa low lying. They know if it's abruptio, they can see it. So some TBAs now, when they see that it is a high risk, they refer to hospital for delivery. Some of them don't. They still try and take risks and try and perform different kind of miracles or concussion. And when they cannot, when it is in a deplorable state, they rush the patient to the hospital to meet her fate.
All right, Dr. Love, let's go on a quick break. When we return, we'll talk about the preventive measures preventive measures in the sense that I know that there are barriers, there are challenges here and there for the women, but how do we prevent all of those, all right? So we'll go on a quick break now. When we return, Health Watch continues. Stay with us. You're welcome back. The program is still Health Watch, and our guest here, Dr. Love, is still in the house. And our topic today is on maternal health. You've said a whole lot about how to manage or how to ensure that there is safety, the safety concerns in terms of collaborating, the TBAs collaborating with the government, all right? So how do we ensure that we don't have these challenges, we don't have these barriers that women constantly face? Because the thing is, if the barriers are still there, even when we do the collaboration, the advocacy and all of that is in place, we are still facing the same thing.
The main problem is that many people in the health system don't try to know the deep root cause of this condition. I'll give you a good example. It's a global thing or a holistic thing. I will start from abroad where I have been and come back to Nigeria. Okay. There are some hospitals in Europe, in Asia, in America. They have zero mortality. For decades, no single woman lost her life.
Why is that so?
Because of proper routine antenatal, prenatal care and taking detailed history. Even when the woman is in a critical state, they are very comfortable because they have done their homework well. They have checked how well, they have done everything they need to do. So a woman won't just die, or a woman won't just develop, for example, preeclampsia, and which will go into eclampsia, like a woman developing convulsion after delivery. Okay. Or a woman, I have seen many women die in hospitals here in Nigeria after delivery or during delivery. And the causes can be preventable. It's not just idiopathic. Idiopathic means something you don't know. No, there is a cause for it. There is a case of another woman that had thyroid. That's thyroid. So she had thyroid, and it was going into a toxic goiter, thyroid enlargement. So in this kind of cases, there are certain medications she has to take, iodine and things like that. She didn't do all those things, and she was going into critical state. There's another case of hypertension in pregnancy. The woman's blood pressure was shooting up the roof, and it was not properly monitored. This woman developed stroke in pregnancy.
Just the kind of baby.
Yes, stroke. Loss of consciousness. Another case, she had preeclampsia, lack of medical negligence, and also proper follow-up by this patient. She developed eclampsia after convulsion, and she later passed away. We have seen many cases of medical negligence.
So doctor, what do you think are the innovative solutions or community-based initiatives that can improve maternal health care?
The innovative solution is when we start looking at healthcare as a standard care and system, and not just as a second place where people just dump people or dump things. The innovative idea is that, number one, the government has to fund the healthcare adequately, and not only healthcare, all other parastatals in the sector. They have to be funded efficiently. Secondly is that people should be encouraged to work. Thirdly is that there should also be massive subsidies. Since they've removed subsidy from health, which is another topic in politics, but they should now look at how they will subsidize health services and health care to make it affordable, accessible, and acceptable for people. It's not a crime for a baby to come to Nigeria. So we should not make it a problem where maternal health care in Nigeria in this year 2025 is suffering and is having a setback. There should be more funding, there should be more political will.
All right, thank you so much, Dr. Lowe.
It's a pleasure.
I could see the passion, I could see at some point you were emotional about it.
Yes, because I've seen healthcare work very well in other parts of the world.
Thank you so much, Dr. Love. We're coming back on this topic on episode 2. Thank you so much for coming on the program.
You're welcome. Thank you very much.
Moving on, CPR, cardiopulmonary resuscitation, is a life skill, a life support skill that everyone should have regardless of your occupation. Let's see this recap on a report that was put together by the Health Watch crew, and Dominic Ajufo, a public health analyst, took us on that report. And let's see what he talked about in terms of the importance of CPR and the steps to follow. Let's see this report together. We'll be right back. Our health matters a lot, but an accident can happen to anyone, anywhere, at any time. Imagine someone suddenly collapsing right next to you. Would you know what to do? I am sure you wouldn't want to be totally clueless in such a moment. That is why it is important to learn CPR, cardiopulmonary resuscitation, a life-saving technique that everyone should know.
CPR is cardiopulmonary resuscitation. That is basically reviving the heart when the heart has shut off, which is more of a cardiac arrest. So it is important that we do CPR because it's a matter of seconds, and we need to bring that life back as soon as we can. First of all, check the environment and make sure that the environment is safe enough for you to touch this person, that this person does not have any electric transmission on his body before you touch the person, okay? And because you know these things, they are going to happen so fast because you know. So while you are coming, you're already checking. So it's not what you do like this. You basically like checking and everything is happening fast. But because we are going through this level, you first of all check if the environment is safe before you touch this person, and you gently turn the person around. Have the contact by saying, "Are you okay? Are you okay?" Or if you know the name, Yalagbaja, whatever you want to do, you call the person by the shoulder. Why do we often do that? We do that in most cases because of the Good Samaritan law as well. That also that you don't have the right to touch somebody except the person gives you a right to, right? So since this person is unconscious, he's not responding, that means you have the right to touch the person based on the Samaritan law, that this person needs help. To be sure you are performing CPR on somebody who has collapsed, not somebody who is still alive and you keep performing CPR on that person. Okay? And that one, we do it simultaneously with something else. While you are checking that, you're checking if the heart is breathing or is pumping. You get? We are looking for sign of life. Okay? We are looking for sign of life in this individual. But the moment we establish that there is no sign of life, it is now time to perform CPR. And when we are doing that, let us be sure that we are in a very close proximity to that individual that we are trying to save. And when we are doing that, it's not like somebody grinding pepper. Your elbow must be straight to get the force. And above all, your shoulder will need that support. So it comes like this, you bring it there, and you push. So you go. Just like that. Okay?
CPR is a simple act that can make a huge difference. You don't have to be a hero, just be prepared always. You can consider taking a certified CPR class or watching an official training video. It only takes a few minutes to learn, but it could save a life when every second counts. Remember, stay calm, act fast, act smart, and never underestimate the power of knowing CPR. And that's why we draw the curtains on this week's edition of Health Watch. Dr. Love has said it all. So we need to, the government, everyone, all stakeholders, we need to work together, all right? Healthcare system that is accessible, all right, affordable and acceptable by all. If you have questions, you have inquiries, you'd love to sponsor this program, please send a mail to okibinchem@gmail.com or send a message to 07060865487. Remember, I normally say that health-conscious people live longer. My name is Nkem or Kibe. Join us next time, same station. Till then, bye.
You want the best in you.